This, again, I'm not telling you not to do it, but I'm saying the risk profile is changing over the age of 70 for people who are using HRT. If you can convince me and your patient feels really strongly that all the other reasons you're using the drug still outweigh that con, great, right? If the bone health and the hot flashes and they feel better, like if we are okay with that, great. Every drug has a side effect. But using HRT solely for cognition and solely for longevity, when we have documented increases in those biochemical bad things over the age of 70, if that was the only reason you were using it, we're wrong, right? We probably shouldn't be using it over the age of 70 if cognition is the only reason you're using it. I mean, we're not even supposed to prescribe HRT for cognition because the evidence isn't clear. And now we have evidence that over the age of 70, it's even less clear and maybe there's a risk. They also found, so here is the sort of interesting piece. So it wasn't in every brain region, fascinatingly. Not every brain region had this like massive accumulation. It was in, sort of specific regions of the brain, which was kind of interesting. And these are in cognitively unimpaired women. So like otherwise cognitively well women were having these massive accumulations of tau and amyloid protein, which are things we don't want. This is why we're drinking the coffee. This is why we're eating the blueberries. But now the HRT is associated with an increase in those proteins. They had this like increase that was beyond like age related change. So people who were not on HRT didn't have the same rapid accumulation as the people who were on HRT. The other complication is that patients who were ApoE4 carriers who were on HRT had an even greater deposition of those proteins. So now age plus ApoE status plus HRT was putting people at the highest risk of deposition of the proteins that are known to be associated with an increased risk of dementia. The ApoE carriers who never used HRT actually had the same level of accumulation as the other people in their age group, right? It's so they even though ApoE status really does increase your risk of cognitive decline, the carriers who had never used HRT, they were kind of in the same group as the other age-related changes. It wasn't necessarily more rapid than in this particular population than people who were not an ApoE carrier. But if you were ApoE plus HRT, then you were higher accumulation of beta amyloid than non-carrier plus HRT.